why adolescence presents such a great or a key opportunity for prevention. Because it was interesting, Dr. Murad said that over here, the incidence of self-harm, you don't see self-harm before somebody attempts suicide. If somebody commits suicide, there's no history of their having harmed themselves before. But overall, it seems that people who are suicidal, who have suicidal ideation, or who attempt or commit suicide, the onset of these symptoms actually starts during adolescence. So there's been something in their adolescence where they might have had suicidal ideations, or they might have tried to harm themselves, and of course, possibly that was not picked up. So in some ways, I really feel like this age group is where we need to focus much more on. Not that we don't want to focus on any other age group. So these are just figures that just goes to show how huge a problem this is. And you can see that it's one of the top 2 causes of adolescent death in certain parts of the world. And globally, it is the 2nd leading cause of death for older adolescent girls. Now, in Pakistan, I think Dr. Murad has already shared with us why we don't have good, accurate figures, but these are crude figures that were reported by WHO 2014, and I think probably Dr. Murad may have contributed to providing them or whatever. So, okay. Now, suicides and self-harm in children under 15. I feel that a lot of times we feel that children will not hurt themselves. And I think certainly it is true that children who are under 10, there's a very low rate of actual suicides, although there are documented cases, but the rate is very low. But certainly beyond 10, so from say 10 to 12 to 15, there is a lot, there are many cases, children who attempt suicide or who have suicidal ideation. But overall, if we look at it, the suicide rates are lowest in children of this age. Just talking about the risk factors, I think that, Dr. Asma, agle slide. So I shared with you earlier that I have been working on with an NGO, and we work on violence, and we work on emotional health. And I see that there is a great connection between these two, okay? So in the risk factors that come up again and again and again is a history of trauma, and especially of sexual abuse. And you can understand that a child who is being sexually abused, and we don't have to go into details about that, we all understand that the stigma that lies behind and the silence that prevails over this issue of sexual abuse, it sort of isolates children. So children are not able to talk about it, it remains with them, and of course it carries a burden. So again and again we see that children who have been sexually abused are more likely to make suicide attempts, they're more likely to be depressed, they're more likely to have mental health disorders. The history of being bullied or victimized. This is again a huge problem, and we see this as a child psychiatrist, I see this over and over again, that children are being bullied in schools, schools are not doing anything about it. And again, this is being linked to suicidal behavior. Victimization, again, we see this, whether they are being victimized because they are being beaten up at home, whether they are being neglected, whether they're being beaten up at school, Victimization, again, is a huge risk factor. History of having a different sexual orientation. I think this is really important because adolescence itself is a period of life where children are struggling. They are confused often about their sexual orientation, or at times they are fairly clear about their sexual orientation, but they have to keep it hidden for reasons we all understand. Again, when things that are troubling people and they have to keep them hidden, it isolates them. Okay. And as we see, that is a risk factor when people can't talk openly about what's bothering them. The sense of hopelessness. The sense of hopelessness is very much linked to when people give up about it. They feel like what they wanted from their future, they are not going to be able to achieve. And so they give up, basically. And this could be, academic pressure. It could be joblessness. Or it could just be that they feel totally alone. Okay? And the sense of isolation and lack of social support. And I feel like this is, to me, the biggest tragedy, really. Because why should people feel so alone? Why should they feel like what is bothering them they can't really share? And this is not just within the family, but even as a society, when we isolate people by refusing to talk about sexual abuse, when we refuse to talk about different people who have different sexual orientations, when we make them feel like criminals or there's something that's wrong with them, we create this sense of shame within them. And that's where the isolation comes in. This is just something that it's a very recent study that King's College London did, and they looked at over 2,000 18-year-olds. They interviewed them, and these were children who were born in, I think, 1994 and 95. And what they looked at was what is it that made them more prone to suicidal behavior? And this is what they came up with, and they did say that yes, there were other factors as well, but certainly teenagers who were victims of neglect, family violence, crime, and cybercrime, which is again becoming something that's becoming a problem in our country as well. They were much likely to have suicidal thoughts compared to those not victimized. And of course, over here, I just want they said family violence, and I thought to myself, what about school violence? And certainly in our society, schools, teachers abuse children, and I mean, they beat children up, so that again becomes a victimization. And I think this is an important fact that for each additional type of victimization, the risk of suicidal ideation doubled and the risk of attempted suicide tripled. Okay? So again, are we looking at these children who are being repeatedly victimized? And in our, if I talk about Pakistan, we are, I think Dr. Asma, Dr. Murad mentioned this, the pressures in our society are so much that there is no way that our children are not being traumatized. So, okay. So this is something that, again, we saw very clearly, that how when suicide is by a relative or a close friend, how it affects the whole family. But certainly for adolescents, this creates a big risk factor because not only are they're dealing with the grieving process of losing somebody they were close to, but imitative suicide is a real phenomena. So, and 5% of all youth suicide seems to be because of other people committing suicide that they were close to. And of course, biological and genetic things are there. Um, this is the single most important predictor of death by suicide. And it is sad to say, and again, I think Aisha will probably talk more about this, but so many times I hear families, close relatives say, drama kar rahi hai. If it's an adolescent girl who has attempted suicide, the words used are, ye drama kar rahi hai. Okay? So obviously, agar koi drama kar raha hai, to she's not going to be taken to a professional for help or to anybody for help. And neither is she going to be talked about in a supportive way. Okay, the impact of children under 12. I talk about this because often when somebody dies, when a parent dies, the focus of people often is on the surviving spouse or the adults in that family. Very often, nobody bothers to talk to the children. And we can imagine that if it's a suicide, then the kind of secrecy that and the stigma that involves this, that is, especially children are not talked to about that at all. And children, being children, they pick up signals, they pick up all kinds of things that are happening, and the secrecy and the whispers, and they imagine all kinds of things then. You know, whatever their age is, according to their age, they will come up with reasons why a parent might have committed suicide. And unfortunately, a lot of times that reason could be, maybe it was me. Maybe because I said one time, I hope you die, or something like that, right? And can you imagine the burden of carrying that? So these are just figures that are there. And one can understand why there would be clinically significant suicidalization. Now, protective factors, I think Dr. Murad has already talked about this, but the strong personal relationships for adolescents especially are so very important, that they have somebody that they can trust, they can talk to, they feel like they can share. So many times, as would have been the experience of Dr. Murad and Dr. Asma, people have come to me and they've said, we have never shared this with anybody. Whether it's sexual orientation, whether it's a history of abuse, we have never ever talked about this, okay? And I think it's just a tragedy. The healthy lifestyle practices, again, to encourage that to people who look after themselves are generally protect themselves from suicidal behavior. Good self-esteem, you know, if you think you're worthy, if you think you're worth something, you're much likely to want to hurt yourself. Assertive behavior, effective problem-solving skills. Dr. Asma, tell me the time, because I don't have it. I'm okay, all right.
So you can just take one more minute.
Okay. So recommendations, again, I mean, there's no question about it that we have to start talking about this. We have to break the stigma about suicide. We have to decriminalize. We have to push, because there is absolutely no evidence that decriminalization will increase the rate of suicide. There is no evidence for that. And when we criminalize something, we all understand that people don't report it, people don't seek help, people don't talk about it, right? We have to break the silence. We have to gather data, because we have to, not only do we want to know how many suicides are there, we also want to know what are the means of suicide, which are the areas, like, you know, if Ghizr is an area, there could be many other areas where suicide rates are high. We need to be able to identify them. We know for sure that minimizing or preventing access to means of suicide is a way of preventing suicide. So if we can find out what are the means, then that would be helpful to us, right? For educational institutions, I feel like I think this is something so essential that we have to have, in educational institutions, we have to have teachers, staff who have to build good self-esteem in children. I think it's important to value all children, no matter what they're doing, no matter what they're doing academically, right? And the academic pressure at times is just, that's all that schools seem to focus on, and that's very detrimental. I don't know of any schools, and I hope there are some, who have a zero tolerance policy for bullying. Somehow, the stance is, you know, this happens in children, okay? And nobody seems to understand that these are serious consequences that there are for bullying and victimization. I think schools need to focus on emotional health much more. They need to build awareness of common mental health disorders. They have to encourage assertive behavior. I think emotional health curriculum is essential for our schools. We have to teach effective problem solving to our children, and we have to talk about suicide prevention. We have to talk about suicide prevention. Okay? We know that the majority of suicides, like Dr. Murad said, are preceded by warning signs. So it's very, very important that we become aware of those warning signs. So, Dr. Asmani. So we have to, and you know, there's no way that we can come up with enough psychiatrists or enough psychologists. We have to build gatekeepers in the community. And these gatekeepers can be parents, they can be teachers, they can be community elders, they can be peers. What they have to know is, what are the warning signs? They have to be able to pick up those warning signs. They have to be able to support these children who are vulnerable, right? And in the medical profession, a lot of these children are seen by pediatricians, by emergency care staff, who have to be vigilant about abuse. They have to ask about abuse. They have to identify signs of depression, and they must ask about suicidal ideation, which they don't. Okay. Next slide. And of course, this is something that is crucial. I mean, we can't be building awareness without having resources. And so we have to somehow get this going. Thank you.
Thank you. You wanted a question? So what we